while we're discussing this, we need to know how much supplies do we have and how much products do we have to address the issues of family planning.
I'd like to remind you a few issues regarding the policy dialogue on domestic financing of family planning supplies in Uganda, and issues that we have been discussing throughout the last year events, which are very important to continuing to pursue issues related to family planning. Of interventions using a multi-sectoral approach at the national and subnational level. Regarding financing for family planning communities, as part of the Family Planning 2030 Global Partnership, Uganda launched 6 commitments at the end of 2021 as a pathway to achieving the targets of increasing the modern contraceptive prevalence rate from 39 to 50%.
We keep reminding them that you have made a commitment, but how do we support them to fulfill that commitment? We are not auditing them, but we are working together. We want to ensure that we have that mutual understanding, mutual relationship to engage them to fulfill those commitments.
Partners have been tracking budgets. Some of us here have been tracking budgets over time, and majority of the partners do not go beyond the allocations. The allocations means the money that appears in the budget that is supposed to do something. But this does not just, looking at the allocations does not answer the questions of how has this money been utilized and has it actually reached the end user. So this study sought to go further than that, further than the allocations and disbursements. Disbursement is, now that the money has been allocated to this entity, has it actually moved from the budget documents and whatever, has it been sent to the accounts? For instance, from the Ministry of Health, has it moved to the entity? Has it moved to the Ministry of Finance, Planning and Economic Development? Has it moved from there to the specific entities like the Ministry of Health or the National Medical Stores? And how often does this happen? This normally happens on a quarterly basis. That's the step that's in between the allocation and the expenditure.
And that is universal health coverage. So if we can work together and we don't look at government as government, because we are all citizens of this country, so we are part of a program, we can achieve for family planning. So the study was looking at where are the gaps. Charity's presentation was addressing the monies, the budgets. This one is specifically looking at capacities of CSOs to be able to use that information and engage with the policy and decision maker. But 3FHI wants to address those gaps so that all civil society organizations, at least a number of them, are able to engage in that dialogue with government officials. And then specifically, for us to be able to get to that level, this study mapped the CSOs, and in mapping CSOs, who are looking at what are they doing as civil society organizations in terms of advocating, but also accountability for family planning.
The challenge is that what we normally discuss here is not what is in the community. The issues of accessibility, the issues of mindset and that. But again, without resources trickling down up to the end as per that cycle, from allocation, how much reaches to those winners as they are according to the family planning posted implementation plan.
It's really for us to be able to implement the national health insurance as part of the financing strategy. So I would want that as we put advocacy and accountability, we should also be able to push advocacy on the demand side so that we can have resourcing if we want.
Modalities that we see in our country. We acknowledge that family planning plays a central role in improving the health of mothers, infants, and it empowers women and reduces poverty. Third, we recognize that through various policy instruments, government of Uganda recognizes the importance of investing in family planning to facilitate scaling up, access and uptake of family planning services and all the other commodities that come along with it. We as political leaders, we commit to ensure that government fulfills the policy commitments.
We need to look at the focus of our accountability should be at two fronts. One, increasing domestic allocation, which I really see, the pledges, the commitments, the declarations are quite strong on that. But I haven't seen so much on how we can also better and more efficiently use what's being allocated. I think the conversation has skewed a bit to the past, and we didn't dig that, a bit deeply into the second, and yet that's also very important.
Thank you very much, His Eminence, for warmly welcoming us and giving us some highlights about what ReFHI has done, and also giving us assurance that as a country, there are a number of achievements that we have been able to reap from working in partnership and in collaboration. As you have heard in His Eminence's welcome remarks, this webinar would not have been possible without support of the Reproductive Health Supplies Coalition. We are also joined and we are privileged to invite Ms. Sarah Webb, the Technical Officer at the Reproductive Health Supplies Coalition.
Thank you so much, Dr. Betty. Good morning, good afternoon, and good evening to our colleagues who are joining from around the world. As Dr. Betty mentioned, my name is Sarah Webb, and I'm a Senior Technical Officer at the Reproductive Health Supplies Coalition, or RHSC. I am incredibly honored to have the opportunity to provide opening remarks for today's discussion on the critical importance of accountability for family planning supplies. First and foremost, I would like to thank our hosts, the Faith for Family Health Initiative, or 3FHI, as well as the many colleagues from HEPS, 3FHI, the Nguru Youth Network, the Uganda Ministry of Health, and many others who have come together to share their experiences and learning today. And finally, a humble thank you to His Eminence on behalf of 3FHI board members and other religious leaders in Uganda for their support of family planning and for his welcoming remarks to get us started. As the world's largest network of reproductive health supplies organizations, RHSC focuses on ensuring that all people in low and middle income countries can access and use affordable, high-quality supplies in order to achieve their reproductive health goals.
Introduced, I work with the Coalition for Health Promotion and Social Development, and this is to also confirm that we are part of the Joint Accountability Advocacy Initiative that has brought us to this webinar today. And for family planning in particular, we know that in a bid to streamline the flow of commodities for family planning, the Ministry of Health approved implementation of the One Facility and the One Warehouse guide for Uganda in 2019. And as HEPS Uganda, we went ahead to conduct assessments for the rollout of this guide at subnational level. 2 rounds of assessments have been conducted, and we have not done this alone. We have done this as part of the Family Planning Consortium, but we have also worked with other partners like Samansha Medical Foundation to conduct rapid assessments around the rollout and implementation of this guide at country level.
In a nutshell, the model is about generation of evidence. So we're able to conduct a landscape study to look at right from allocation to disbursement, expenditure, and also how the resources for family planning commodities are utilized aligned to the needs. And the findings from the study were very interesting, which are not very different from actually some of the issues that already highlighted. One, we serve very low allocation for family planning. though we appreciate that the government of Uganda through the advocacy engagements, we've been able to realize some commitments. For example, Joan already talked about the 25% allocation, promise allocation or commitment from the FP 2030 commitment of the 50% of reproductive health supplies going to family planning. Right now, the biggest percentage, almost everything that is allocated through national medical stores goes to reproductive health supplies and mainly mama kits and others. So from the study, again, we're able to engage. We had a dialogue with the decision makers. So I would say it was multi-sectoral because we had religious leaders, cultural leaders, we had civil society, we had FBOs, we had different heads of departments from different line ministries. And we were able to come up with a number of commitments to see how we are going to address some of those issues. And some of, again, the issues that were realized from the study, which we are still engaging, is the ability to access all the data.
All right, I'll be brief. I'll talk about the iReport and how we've used the iReport to monitor adolescent health services and empower young people to demand for accountability and improve service delivery. So the iReport is a youth-driven initiative that engages youth and youth-led organizations in monitoring health programs that respond to their needs. We've implemented the iReport in 10 districts, targeting 14 health facilities. And in these health facilities, we've conducted quite a number of studies, including exit interviews with young people to assess their satisfaction with health services, where they've informed us a lot about the service delivery in those health facilities. And we've used the findings from our studies to engage the health facilities to improve access to youth-friendly services. How we do it is that we mentor and train community monitors. We've so far trained 20 community monitors in the 10 districts who are responsible for collecting or gathering the information, and then we engage the health facilities and the districts in improving the health services.
Society organization and NGOs of NGOs and CSOs that follow the family planning and reproductive health, it gives us quite a lot of information. But the accountability agenda in reproductive health and family planning, it has been through a symphony of strategies, if I can put it that way, the media channels that have rallied together to foster a world or a country where every individual's reproductive rights are honored and every family planning journey is supported. So I tried to put a couple of down of those different strategies. We have harmonized as a pivotal cause to propelling the change we need in the family planning conversation. One is empowering dialogues. So media platforms have orchestrated riveting conversations, spotlighting real stories of empowerment, documentaries, talk shows, and podcasts that are changing the narrative or sending it further to break the silence and foster a culture where individuals unabashedly embrace their reproductive choices.
I also would like to appreciate Faith for Family Health Initiatives, that is 3FHI, with support from Reproductive Health Supplies, our coalition, for organizing this important webinar on family planning supplies investments, and more so with a focus on the area of accountability, because many times we actually do talk, but at the end we don't reflect on what we committed to do. So I'm very glad that this webinar has been organized to reflect on what we committed to do and also where we are. Many times when we make commitments, they tend to be so broad, sometimes ambitious, but they help to drive the agenda So we would really appreciate whatever we have been able to achieve. And as I was also listening in, the issue of advocacy came in came out very loud, which I really appreciated, because without advocacy, without other stakeholders speaking on behalf of the beneficiaries, our government may not act. So it's very important that we listen and then also work together to advocate for the various partners and stakeholders to ensure that we actually achieve what we set out to do collectively.